This is ectopic canine. What is ectopic canines? An ectopic maxillary canine is a canine which is following abnormal path of eruption in the maxilla. In the picture given below, you can see the red arrows showing the ectopic canines. Normal path of eruption, and it is erupted more palatally. You can see in the picture. Now, there is another picture which is showing the ectopic canine, but it is also following abnormal path of eruption, and it is erupted more buccally. Now we'll talk about another term which is impaction. A canine is considered as being impacted if it is interrupted after complete root development, or the contralateral tooth is erupted for at least 6 months with complete root formation. So, by this definition, you can clearly understand in the picture given below. So this is now we'll talk about another term which is also important. This is transposition. The most severe form of ectopy is transposition. This is positional interchange of the canine with another tooth. Look at the picture. The red arrow is showing the canine which is interrupted between the two premolars. So this is the positional interchange of the canine. It is not. Now we'll talk about the prevalence. In Caucasian populations, the prevalence of ectopy and impacted maxillary canines has been estimated to be between 0.92 to 2.2%, with 85% of these ectopic teeth being palatally to the line of arch, whilst 15% are located buccally. Now look at the pictures. This is the palatal impaction and the other one is buccal impaction. The chart is also demonstrating the prevalence of the impacted canines. Look, the buccally impacted canine is 15% and 85% is palatally impacted canine. Now we'll talk about the most common impacted tooth. The most common impacted tooth is maxillary and mandibular third molars. Look in the X-ray. The red arrow is indicating the upper and lower maxillary and mandibular third molars which are being impacted. The second most common impacted tooth is maxillary canine, and the mandibular canines are the fourth one which are impacted tooth, but the results in the absence of symmetry than the normal. The other one is limited deciduous canine prognosis, often with poor aesthetics, and it is resulting in absence of canine protected occlusion. So you can see in the picture it is showing the canine protected occlusion, and the aesthetics are also not poor. But if the canine is absent, then it will result in poor aesthetics. The other problem which is caused by impacted permanent canine is the resorption of the adjacent permanent teeth. There is showing the impacted canine and which is resulting in the resorption of the adjacent permanent teeth. The other problems are internal or external resorption of the impacted canine. So in the picture you can see the red arrow is showing the pink discoloration, which is very helpful for diagnosis of the resorption, especially internal resorption. Cyst formation around the unerupted canine is another problem. You can see in the picture the red arrow is showing the cyst and it is around the unerupted canine which can develop because of the impaction. So the impacted canine can also result in the obstruction to the movement of nearby teeth. The other problems we'll discuss are unwanted movement of the adjacent teeth caused by impacted canine, loss of arch length, and flattened nasolabial fold due to the absence of canine eminence. and the other problem is referred pain. Now we'll talk about the theories of palatal canine impaction. Two major theories associated with palatally impacted maxillary canines are guidance theory and genetic theory. Why do canines develop ectopically? According to guidance theory, the distal surface of the permanent lateral incisor root guides the developing permanent canine into the line of arch. Now we'll talk about genetic theory. This theory considers impacted canines are a result of multifactorial inheritance. They based their story on the fact that palatally displaced canines are concomitant with other dental anomalies such as premolar hypodontia and peg laterals.